and welcome. I have these two lovely ladies here in front of me, specialists from Boca Raton and Vero Beach. The lovely Dr. Priti Kothari. She's a board certified child, adolescent, and adult psychiatrist, and she has a practice in Boca and Vero Beach. And the lovely Jennifer Dio. She coordinates with Dr. Kothari as a board certified nurse practitioner, and she specializes in pediatrics and adult psychiatry. So welcome, welcome, welcome. Anything you two would like to share?
Well, we really appreciate the opportunity. Me and Jennifer work really well together. She's new to my practice, but I have tremendous confidence. She's learned so much so quickly. And I really want to highlight the importance of nurse practitioners and mid-level practitioners to the community. There are not that many board certified child psychiatrists like myself, unfortunately. We are few and far in between, and many of us are already full with our practices. And in the chaos of what's happening to our world, I want to give people out there confidence to reach out to psychiatric nurse practitioners, because they're not only nurse practitioners, they've done additional training in psychiatric work and have had further degrees and certification. So I just want to be proud of mid-level practitioners and understand their role today as well in the collaboration of treatment for mental health for children and adults, especially in the time of COVID-19.
Yeah. Hi, Jennifer.
Hi, thank you for having me.
Thank you for being here.
This is a difficult time for all of us with the coronavirus out there and lots of anxieties, and parents are busy with their children, trying to juggle work from home and teach children from home. So it's all uncertain, and I'm glad that we're here. So Dr. Kothari and myself can let you know just exactly how how we deal with what's going on right now.
Wonderful, wonderful. And I'm so happy to have both of you experts here today. Not only am I just flabbergasted with everything that healthcare workers have been through right now, but it's so nice to be talking here with you guys as experts, because as an ADHD coach, I'm feeling it, my clients are feeling it, my friends are feeling it, all the stress and anxiety around this. So I would just love to pick your brain while you're here so you can help us with some natural ways of managing all of the health issues.
Sure.
Attention.
Yeah.
A lot of attention. As Americans, we value freedom. We're all about freedom. And we have a tremendous infrastructure and beautiful cities and tremendous communities and school systems and churches. And I mean, this is Sunday, we go to church, or, that was kind of hard today because many of us are praying and many of us are grieving. And, I followed the Easter Sunday cycle, and there was a loneliness in that. And one of the things we should probably talk about is social isolation and how to cope with that. Because I think the trauma of just what's happened and how quickly it happened to us is kind of sort of fading in, and now it's starting to become a reality. That
Sure.
You don't have all the questions. We get lots of mixed opinions, and there's a lot of bias in the media, and we're really just sort of, as citizens, forget about me being Dr. Priti Kothari, think of me as just Priti Kothari. As a citizen of the world, I am overwhelmed and confused as to what and where and how. And I think everyone's feeling that. What,
yeah,
and where and how.
Yeah, and thank you for being so honest and vulnerable. Sometimes people look at healthcare professionals coaches, whatever, and think that we all have it together because, you know, we're here to treat others and help others. But really, like, all of us are suffering and struggling in some way.
Mm-hmm. Mm-hmm.
Right. But that coordinate with Jennifer. Jennifer can speak to that, how we help support each other as collaborators, you know, in
Yes.
mental health.
Exactly. We're there for each other. And that's part of being a nurse practitioner, is having someone that you can talk to and bounce your feelings off of, without going straight to medication. Just communication's important. Just sitting with Dr. Kothari and discussing a problem over a cup of chamomile tea means so much. It can bring our anxiety level down greatly. And we always make sure that we have enough sleep. That's very important.
And I'm sure it's not just sleep, right? It's reliable sleep. Like, what does that even look like? How do you get that?
Yeah. Yes, it's reliable. Go ahead, Dr. Kothari.
Sorry to interrupt. One of the challenges has been how various school systems, both private, charter, homeschool, have handled this. What Jennifer brought up was the challenge of, I'm a working mom. I wake up, I have a schedule. My son has breakfast, we eat, I drop him off at school. He's in his uniform, right? Everything is kind of like tight. And then I run to an office, and then I have support staff. Well, that support staff is now, at home. They're there for me, but it's not the same feeling. They don't get to bring me the chamomile tea, right? I make myself the tea, which is lovely, but it's not so much about bringing the tea. It's about that feeling of warmth and human touch and intimacy.
Sure.
I'm not able to see my patients across my table, or let's say if a kid's anxious or vulnerable, I'm not able to get on the ground and get to his eye level and really make him feel at home in my office. Life is about being at home or coming to home. Many of us go on these journeys, like me. Like, I became a physician, right? It's a hell of a journey. I never knew what a journey it was until COVID. Many of us have felt that the public has respected us more, and many of us have felt very vulnerable and alone in our journey to conquer COVID and yet protect our own health and our families. And I think a lot of that's also, not to get into politics, but somewhat regional, and even maybe somewhat related to who you're with. Like, when I'm with Jennifer, I'm at home. Does that make sense?
Absolutely.
Even she has to run a case by me, I'm available to her, and we're at home.
Sure.
How do you find home within your work family, and then how do you take care of children who are running amok in your home? Because some schools have gone down to 1 or 2 days online.
Mm-hmm.
Some schools are carrying it for 9
Mm-hmm.
hours. It's all about structure. Babies are born, and we feed them every 4 hours. We start our life with a baby, with a schedule. It's all about schedule. How many times did they poop? How many times did they feed? Do we need to soothe? When's the bewitching hour, right? It's all about that schedule. We start our life with that precious gift that God gives us, that beautiful child. What a gift. And there's bells ringing in our homes, and the families are joyous, right?
Yeah.
And now we've lost structure. And many times families are reaching out to us. And Jennifer, maybe you could speak to this, about some of the chaos and how we have to sort of normalize some of that for them instead of quickly just jumping to a medication.
Yeah, that definitely. And I think it's a loss that these children are dealing with. It's the loss of structure, the loss of their social aspect of their life, loss of a routine, the loss of going to bed at their bedtime hour and getting up and having their breakfast, like Dr. Kothari said. So it's dealing with that. The kids they're not connected. And the only way they do connect is by TikTok or the social media, the FaceTime, the Instagram, the Snapchat. And truthfully, I know in a time like this, we kind of let it go a little bit and we kind of turn our heads, but really we should be keeping eye on how much time they are on social media, because I think it's not good for them. It's not good for their brains, you know. I think keeping a schedule is the biggest thing for these kids.
Mhm.
I was just going to say, even for the kids who are not on social media, let's say their parents have worked so hard, right, to really kind of keep them away from that drama, especially middle schoolers. That's a very vulnerable age.
Sure.
But yeah, maybe on, PlayStation, or, they might be gaming 8 hours a day and it's like lost. Moms are just people are working from anywhere from keeping their home septic. There's a lot of mothers who are, look, they use this term OCD. Well, right now, OCD is the new norm, okay? It's nothing wrong about wearing a mask or taking gloves. That's what we doctors are preaching, right? Cautious, right? We're telling
Right.
you, the OCD, right? That's basically what we're saying. We're saying, you better be on top of this, mama. But how
Right.
much can a mother do? An 8-hour job, right? To bring food home, to take care of her husband, maybe elderly parents, children. And I especially have had tremendous compassion and tremendous respect for my parents whose children have autism, especially nonverbal autism. Those children can cry for hours, they can bang a head. There are families now that are getting into arguments over what channel can be watched on TV. And then there are
Yeah.
families who are staying completely and calm and trying to normalize and meditate in the midst of a child banging their head. It's all about how do you approach it and how do you predict?
Sure.
And what are your
Sure.
expectations of your child?
Sure. Yeah. I mean, I don't personally have children of my own, but in my parent coaching and just people that I'm talking to, it's been really, really tough for them. And they do allow a little bit more of this freedom within the constraints of the house and in their backyard, rather than doing an 8-hour school day or a 5-hour school day. So a lot of schools right now are doing prepared videos, right? So the kid can log on at whatever time they want to. So they don't necessarily need to start school at 8 a.m. They could start school at 10 a.m. So yeah, there's a lot of flexible scheduling. For me, I know I'm not a parent, but I am a parent coach. And I find that just being on whatever routine it is, make that routine consistent. So like you are coordinating your own schedule and school day. Like you had mentioned, routine is so important.
I mean, many traumas with children. I mean, me and Jennifer serviced the Florida area, and we were some of the primary mental health care for many of those families. And, I started my career with AIDS in 1989 in Brooklyn at Downstate, while I was an undergrad in anthropology and women's studies, and I was trying to learn about Haitian women who were infected. I started my life with learning about advocacy for women who were marginalized in society and children who were marginalized. And right back to 1989, I've been through all the crises. A lot of us are. Many of the doctors of my generation we're sort of, in the late 40s, early 50s. We've been through it all. AIDS, opiates, crack, 9/11, Parkland shooting, multiple school shootings, Ebola, SARS, you name it, a lot has happened. And yet we have so much respect for our predecessors. What happened to a doctor when there was no penicillin? What happened to a doctor when he was a barber and he was a surgeon? That's how surgery started in a barbershop.
Wow.
We have tremendous respect. Look back at them and we think, wow, we've never forgotten them. We've never forgotten smallpox. We never forgot before there was immunizations for measles. We remember the Spanish flu.
Mhm.
But yet, many now remember us and say, what happened to those doctors? How did they take on the mental burden of people who were so lost and so marginalized? But we
And how did
carry
they?
on and we stay brave and we stay connected and we stay brave. And just doing this right now is part of connection.
Sure, sure. So I keep hearing the theme of staying connected, whoever you consider your family, whether it be your work family, your friend family, your family, trying to reach out to those people, whether it be virtually or 6 feet apart or on the phone, just having that human social connection can just bring you back to some sort of normalcy. Normal, not
Right.
normal, the new normal, as you were saying.
To our patients, especially when they're depressed or anxious, especially women, not self-soothing, because I think women are always thinking about everyone else and they put themselves last. Not to be biased, but just seems to be the trend in my practice. It is what it is. And maybe Jennifer, now self-soothing takes a whole new role because who else is there to soothe you, right? So maybe you could
Correct.
speak to a little bit about how to soothe yourself. How to soothe yourself from a non-medication standpoint. I'll allow you just because me and Jennifer do talk a lot about this.
Yeah, and like Dr. Kothari mentioned, connection, communication is one way. You can even do a Zoom exercise class. There are plenty of apps on, the iPhone that you can download on your phone. Many of them are free. Yoga, meditation, Zumba, some body sculpting class. There's an app that I use for sound on my phone when I'm stressed out, and I've had a long day being on the computer and talking to patients. Even though I'm not physically with the patient, it's emotionally a lot of work to work with patients, 8 hours, 10 hours a day. You never stop thinking about these people.
Sure.
Your brain never shuts down. You're always thinking. So diet is important. Staying away from alcohol and staying away from caffeine, which can bring on anxiety. Drinking lots of water, some caffeine-free teas, drinking those, getting enough sleep, taking B vitamins for energy, taking a multivitamin, using some elderberry products can help with your immunity. Exercise, that's the biggest thing, going for a brisk walk. If it's really difficult at home with the children and work, make the kids go outside and do 25 jumping jacks and you join with them. I'll do that with my own children. Let's go for a walk, even if it's around the block one time.
Yep.
So
Totally. It's like a low dose SSRI.
Exactly.
Right. Yeah. I always say that if you do a consistent yoga practice, is equal to 5 milligrams of Lexapro. It's just my inner joke, but I'm not actually joking. Sometimes people, when people on addiction, we tell them to basically, they have to chase the meetings, right? Addiction is such a strong disease biologically that to stay close to your sponsor and to find the right groups, the AA or the NA, and work your steps, the 12 steps. Well, in yoga, I feel like many times this is what anxious and depressed women are, and men and children. We have yoga for every age now. And the elderly, we have chair yoga. You don't have to do a headstand. That's about ego. This is not a time for ego. COVID has humbled all of us, okay?
Mm-hmm.
And I think this is really about breath and pranayama, breathing. Yoga can be done right here, right now. We could all just do it for a second. You want me to do it? Let's just do it. Take a deep breath in and just relax your shoulders. Let it go. Don't be scared. Sounds. Whatever sounds you want. You want to moo like a cow? Moo. Be a lion. Roar. Feel your power. But just like we work our 12 steps in addiction, we work our chakras and our meridians and our wellness through our system. And if you don't subscribe to that system, you find another system, something, whatever calls to you. So we call it Ujjayi breath, and this is called ocean breath, and this is how we do it. We try to get ourselves into crisscross applesauce or lotus position. We make ourselves comfy. We use bolsters. You can buy lots. Actually, everything's sold out yoga right now. Good luck finding it. But there's lovely companies like Manduka, and you take your time. What I've learned about COVID is we've always rushed as families. We're rushing to sports fields and rushing to schools and rushing to work and rushing to band practice. And you know what? If you rush in COVID, you catch the virus. You make one wrong step in this game, you touch one wrong stupid handle, and there you go, right? And the tremendous burden on the mother. Johnny, don't run. Oh, don't bring that box in yet. Do you get where I'm going?
Yeah, so this actually allows us to slow down, right? Be more present, like you said, with those strategies of whether it be taking a walk in the morning with your kids or doing yoga practice, deep breathing, meditation, just, you know, catching your breath and being still rather than rushing all the time. That's huge, Dr. Kothari. And it really does bring us back and like take a moment to think about what's important rather than rushing around like we used to. So I appreciate you saying that. So I
just brought up some teas, and there is some discussion because I am from the Indian culture. Just want to bring up a couple of herbal ideas. I'm not, you know, this is medical disclaimer, but just if this helps you. A lot of this is about our immune system, and we, like in India, we use a lot of turmeric, cumin, coriander, and garlic. It's very good in cooking. You can just use it in food, or you could sprinkle even basil leaves. Many Italian people love that, you know. There's just some extra goodies you can give yourself every day. This is a time to treat yourself. This is a time to nourish yourself. And we also really like inhalation, like there's been discussion about Vicks Vapor Rub and inhalation just to open up. We want to strengthen the lungs. Yoga strengthens your lungs through breath and practice. And it's not only about muscles and joints. It's really about lung capacity and wellness. Obviously, staying away from cigarettes or any illicit drugs and alcohol, like Jennifer mentioned, is critical. But unfortunately, and I understand, we're all human, it's an easy way to self-soothe. We want to try to give you some alternatives. So herbal teas, there's one discussion about Kada, K-A-D-H-A. Some people talk, some people like, some don't, but I'm just giving it out there. Basil, cinnamon, black pepper, ginger, lemon, hot water and lemon. In India, we drink that every day in the morning. We're talking about drinking warm water 3 times a day, golden milk. And these are just some tidbits, if I can give you nutrition and immunity, along with, of course, we've talked about zinc, we've talked about B complex, we've talked about the elderberry, like Jen mentioned, we've talked about the role of omegas, vitamin D. I think they're a very good supplement with greens, minerals, magnesium. I think all of this is out there, and I think people this is what is at your hands, right? At the end of the day, we can only do where our hands can reach. I know that part of the grief is guilt, and I want that to be washed away because I don't like people to get sicker. I want to get people better. That's my job.
Sure. And when you feel good about yourself and you're healthy, then you can give more to others, right? So self-soothe and put your oxygen mask on, right? To take care of your family, to take care of your friends, to take care of your loved ones. I'm sorry, I know I cut you off.
Correct.
Yeah, no, but all of those were wonderful, wonderful ideas. And I know that both of you, your time is so valuable and I love connecting with you. You both are resources of information, wealth of information. And it's really cool to hear two people in the medical industry talk about natural ways to take care of yourself that are at a hand's reach, like you said. So I would love to pick your brains moving forward if we do this again, talking about other ways you feel connected, other ways to lessen anxiety, and anything that can help the community at this point from your medical standpoint or your mother standpoint. Thank
I
you,
think at the
ladies.
end of the day, we appreciate it so much, and namaste and peace, and thank you, Jennifer. She's my partner, and thank you, Brooke. You're also another partner.
This was a great opportunity.
No, I don't
Thank you so much.
Yeah.
realize this. Brooke, you are a leader in our community in South Florida. You are a precious gift. You came from New York, from a top school district. We all know. Don't be humble. And you really know your stuff from an educational standpoint, an emotional standpoint, and you really know how to bring out people's self-esteem. You take people higher. And that, as a child psychiatrist, anybody in the community that is helping us, because I'm only one part of that pizza pie. Anybody
We're all
else
in
is
this
part of
together.
that pizza pie.
Thank you. No, thank you guys. Thank you. We're all a team, and you know, our individuals need a team, and we need a family. We need connection. We need multiple individuals who know what they're doing, who are connected, and who care about others to help. So thank you again for being here, and I hope to see you lovely ladies soon.
Thank
Thank you.
Bye.
Bye.
Bye.